So I just finished reading an article about the young woman here in Georgia who is pregnant and being kept alive because she's brain dead. And in clinical practice, especially in this state, brain death is legal death and has to be withdrawn, and patients have to be withdrawn from life support if they're brain dead. However, in this case, she's brain dead but being kept artificial alive because she has a fetus, and she went in about 9 weeks and it's been like 90 days, so the fetus is now 22 weeks. And there's a controversy between her being brain dead and of course the heartbeat law here in Georgia. And like I said, I'm not here to argue the legal clinical stuff because I don't have the full details. But when I read this article, what stood out to me is the mom's comment about them not being included in this decision. No one ever asked them if they would want to keep the baby. And she's like, maybe they even would want to keep the baby alive. But the fact that they were not asked kind of stood out to me too. And I think it stood out because in clinical practice, I've been in lots of cases where we, the clinicians in a hospital system, looked at things from a clinical or a business or an ethical standpoint without always factoring in the human experience. That these are people with real emotions, lives, values, beliefs, and intentions that had this stuff going on before they even came to hospital care. And so to me, factoring in the human experience means taking into account the emotional component that this family is going through. And I think it just should be a part of the dialogue, not excluded from the conversation, but inclusive in the conversation. And it may not change the outcome, but at least it gives families and patients an opportunity to feel heard, seen, and valued in a system. And I think that's where we need to put things back on track. Of course, I'm a patient advocate, so I most certainly feel this way, and it's a very powerful position for me. But I think that in this case, especially with it being so raw and visceral in this state, just having the input of the family could have been invaluable.